Federation discussion largely over the course of the last year as well, not only in addressing the pressures that we have from the global pandemic, but also addressing some of the pressures that we collectively have across the nation that are impacting all Canadians in the way of surgical wait times that we have acquired over the course of this pandemic, in the way of our diagnostic wait times, in the way of providing physician, medical health professional, primary health care services to not just people in Saskatchewan or British Columbia, but collectively across the nation. This has culminated in our effort and our ask as a Council of Federation of the federal government to be a fair and a funding partner, a full funding partner in delivering provincially delivered healthcare services across the nation. And so that is part of our discussion today, as is some of the other challenges that we have as we find our way through the global pandemic, as we rebuild our economies, as we look towards the future, in ensuring that our respective provinces and territories, as well collectively as our nation, is in the strongest position to really succeed as we look ahead and look beyond a COVID-19 pandemic. But I'll turn it over to my colleague, the Premier of British Columbia, the Chair of the Council of Federation, Premier John Horgan.
Thank you very much, Scott, and thank you everyone for being here this morning. It is fitting, I think, that we come here, the first in-person meeting of the Western Premiers and Northern Territories Premiers in over 2 years as a result of the global pandemic, and to be in the birthplace of Medicare to talk about the future of public health care delivery in Canada is absolutely appropriate. And Scott rightly says, over the past year we've been focused on ensuring that the Canada Health Transfer, which sounds like an administrative accounting procedure to many of you, but in reality this is about how we deliver services at the provincial level to Canadians from coast to coast to coast. And so over the past year, Premier Moe, Premier Furey from Newfoundland and myself have been trying to do shuttle diplomacy with the federal government to get to a place where we can have a First Minister's meeting on the importance of delivering healthcare services to Canadians. This has been not just for the past year. I have been at the Council of the Federation for 5 years now, and just a few months ahead of Scott as the senior premier in the country. And when I arrived at the table, the #1 issue for premiers was healthcare and the delivery of services that are so critical to the people in our various jurisdictions. And so over the past year, as we came out of the pandemic, we did great work. Scott was the head of the council at that time. The Prime Minister and his team were very responsive throughout the pandemic. We met virtually every week for a year and a half to make sure that we were all on the same page. We were sharing best practices, and it was an example, in my opinion, of a federation that was focused on delivering for people wherever they lived, whatever the linguistic or political or regional concerns were. We were there together, despite our differences, to work on behalf of all Canadians. And it was uniformly, I think, and certainly in recent memory, an example of what Canadians would expect from their elected representatives. And throughout the pandemic, we continue to raise the Canada Health Transfer as a critical part of our ability to meet the expectations of our citizens. The Prime Minister repeatedly said, when we get past the pandemic, will be the best time to have those conversations. Well, we're here today, the pandemic is waning, it's becoming endemic, and it's time now to have that conversation. For the past 6 months, we've been trying to get a path forward to a negotiation about how we can best deliver these mutual concerns. And I'm uniquely situated as someone who has been testing the various components of the public healthcare system over the past 8 months, from diagnostic through the primary care system, to a discovery of a cancer, to surgery, to post-op, to radiation treatment, and then the accompanying therapies thereafter. I know the strain on the faces of healthcare workers in my community, and I know that's duplicated across the country. For 2 years, Canadians look to our public healthcare system, nurses, nurse practitioners, care aides, doctors, surgeons, to get through an extraordinary time. And we all know someone who works in the healthcare system. We all know someone who has put themselves on the line, put their personal health at risk to provide care for fellow citizens. And now is the time for us to turn back to the system and say, we're going to rejuvenate it, we're going to bring forward new initiatives on human resource development so we can have more healthcare providers for the challenges of an aging population. Now is the time for a new vision for healthcare in Canada. Now is the time for all of us to come together, despite our differences, and deliver what Canadians expect of us. There's nothing more Canadian than public health care. And it separates us from our American cousins, and it separates us from those who are concerned about accessing the system because of cost. We're now concerned about accessing the system because of the frailty of the providers and the inability to meet the expectations of the public. Now is the time, Prime Minister, now is the time, federal government, to sit down with us and plan and plot out the future of Medicare, which started in this great province. And I would hope today would be the beginning of that commitment from Ottawa to come sit with us. We're meeting as a council in Victoria, July 11th, 10th, 11th, and 12th. As a council of the Federation, now is the time. We don't need to wait any longer to do what the public expects of us, which is to work together to deliver the services that they